to me, a story is a collection of events in a sequence. It starts somewhere and goes somewhere, and there's a direction, sometimes several directions available in the story. And what's wonderful is that the human being uses words to understand. They're part of the visual process, and we use them inside ourselves to refine our own ideas. So with a story, we can refine our own idea of what's happening. With a story outside of ourselves, we can share what we believe and what we see with another in a way they can receive it and change how they see the world. And the reception is entirely voluntary. And the refining belongs to the person who receives the story. So that it's not coercive like memorizing all the dates. It's a participatory exchange between the storyteller and the person who listens to the story. It's a living, breathing communication between two people. It's funny, stereopsis is two views. And that's how we usually get it anyway. We think of it as two. It really means solid. So that if we want to develop a solid understanding, we need the teller and the receiver to have enough in common, yet enough difference, that they develop a depth of understanding between them. And that collegial or that student-teacher understanding and exchange is what develops the strength of understanding and conviction. So that when we teach young students about the power of the visual process, especially those who've been in practice a year or two, they'll listen to the stories about our patients who are now their patients, and they have that experience to take home for the next patient they see. And many of them tell us, I look at the world in a different way. They're the same kinds of data, it's the same instrument, it's the same room, I'm a different doctor. That's what we hope to achieve, is a different and better and more solid, deep understanding of what it is we do.